So tell me more. How are things?
Well, not great.
Oh, what's wrong?
I've just been feeling kind of down and low energy lately.
How long have you been feeling that way?
I guess for a few months.
Yeah, I've noticed you haven't been your usual self recently.
Yeah, it's just I've been sleeping poorly and I've felt really low motivation.
Those are signs of depression. Have you talked to anyone?
I'm talking to you right now.
No, I mean, have you talked to a professional like a psychiatrist or a therapist?
Sam, I'm not crazy. I don't need a shrink.
Therapy is not for crazy people. It's for everyone.
And I'm fine. I can deal with it on my own.
Erica obviously needs to speak to someone about her mood disorder or depression or whatever it is. A lot of people are hesitant to get help or talk about these kinds of issues. But I have an idea for an intervention. I'm going to suggest that we make a video for English about mental health, and she will be the patient, and that way she can see somebody. What do you say? Are you in? Okay, shh, she comes.
Hey Sam, how's it going?
Oh yeah, good. Yeah, everything's good. I have a great idea for a video.
Oh yeah? What's
Yeah, let me tell you about it.
Welcome to Breathe English. Today we're talking about the language of mental health. First, what is mental health, Sam?
Well, mental health refers to our thoughts and feelings. Good mental health can include having generally positive emotions, healthy relationships, and feeling prepared for handling life's challenges.
Some of the factors that affect mental health are...
We could talk and talk about this, but why don't we just go talk to a professional?
Well, I don't know any professionals.
Don't worry. I actually made an appointment with a counselor at 10:30.
That's in like 30 minutes.
We better get a move on then. Let's go. And in the meantime, please like this video and subscribe to our channel. Hello, welcome.
Hi.
Come in. Go on.
Aren't you coming?
I can't come in. Conversations between patients and therapists are private.
Well, I'm not a patient, but okay.
So, what brings you in today?
Yeah, we're teaching a lesson about English and mental health, and we wanted to talk to a mental health professional.
I see. Can I ask you a few questions then?
Sure, but can I lay down on the couch?
You want to lay down?
Yeah, it's just like on all the movies, they're seeing a shrink and they're like laying on a couch.
Shrink is a little old-fashioned. I prefer counselor or therapist. But yes, you can lay down.
Awesome.
Has anyone in your family had mental health problems?
Why do you need to know that?
Some mental health conditions are hereditary, which means they are passed down from your parents or your grandparents.
Well, my mother is a pretty anxious person. She often avoids social activities, and sometimes she gets really tense and has trouble breathing.
Those might have been panic attacks.
An attack of panic?
Yes, it is possible that even though she has never been diagnosed, she has anxiety. Have you had any traumatic experiences recently, like the death of a loved one, or a big change like a move or a breakup?
No, nothing traumatic really. I did stub my toe last week. Does that count?
Stubbing your toe is awful, but it doesn't count as trauma.
Nothing traumatic, but I guess when the weather gets cloudy and cold and the days are shorter, it makes me feel pretty down.
Do you usually feel down or low energy when in the colder months?
Yeah, I just need sun in my life.
You could have seasonal affective disorder, commonly known as seasonal depression. For many people, when the weather becomes gray and the days become shorter, it affects how we feel.
So what do I do to feel better? I can't afford to move to Miami.
There are a few treatments you might find beneficial. You could try a light box. You just have to sit in front of it for maybe 20 minutes a day and it will help improve your mood. Or you could try talk therapy, which is a little what we're doing right now, meeting regularly with a therapist to work through any troubling emotions you have.
Yeah, I guess I could try that. Wait a second.
Why are we talking so much about me? We're supposed to be teaching mental health terms in English. I'm fit as a fiddle. That's a good idiom.
It's possible that you have seasonal depression, but I think you should be evaluated a bit more. I'm going to refer you to a psychiatrist.
Wait, isn't that what you are?
No, I'm a counselor or psychotherapist or simply a therapist. I use talk and open conversations to help patients work through their problems. A psychiatrist is a medical doctor who can prescribe medications and other treatments. But you should feel very good about taking this first step towards better mental health.
I'm not here to get help. I'm here to teach English. Sam, let's go. And then she said I should see a psychiatrist. I mean, that is wild, right?
Actually, we have an appointment with the psychiatrist at noon.
What? That's like soon.
Yeah, well, to continue the English lesson, I think it's important.
Okay, well, I guess we should get going then?
Yeah, definitely.
I mean, that therapist was a basket case, right?
I don't think she was crazy. The way I see it, she was a mental health professional diagnosing you with depression.
Diagnosing?
Yes, diagnosing is looking at someone's symptoms like having low energy or feelings of hopelessness to define their illness.
Well, then I am diagnosing you and saying that you've lost it as well. I am perfectly fine. Now let's stick to teaching the English lesson.
Well, we're here at the psychiatrist's office.
Well, let's hope this shrink is less bonkers. Really nice office.
What's your relationship like with your father?
Well, let me tell you. First of all, everything I do is just crap to him, and then he calls me unexpectedly, and he expects me to go there and whatever he wants, and then he just supports me, he never supports me, he never supports me, why do you teacher, you should be a doctor, ugh. Nothing I do is ever good enough for him.
It sounds like you are feeling very judged and controlled. We might even call it a toxic relationship.
Toxic like poisonous?
Exactly. In dealing with a toxic relationship, it is important to set boundaries. That means deciding what you are comfortable with and communicating that to the other person.
So do you think this is part of the reason I've been feeling so low? I mean, do you think if someone were maybe in this situation, they could, in theory, feel sad or depressed?
I do.
So what would be a good treatment plan for me? I mean, this person.
I would recommend setting some healthy behaviors to help regulate your mood. For example, eating healthy, getting enough sleep at night, exercising regularly. These can all help control how you feel on a daily basis. Meditation can also be a helpful tool for helping you feel better.
All of this seems doable for a person with depression.
I would also recommend having regular sessions with a therapist, and if there's no noticeable improvements, we can speak about medications that may help improve your mood. Here's a list of my suggestions.
Thanks a lot, Doc. Our English students are gonna learn a lot about mental health and treatments.
I'm so glad. This is a really good list of treatment options.
Yeah, you know, I've been meaning to exercise more, and I might make another appointment with the therapist.
Oh, I think that's a great idea. But you know, there's one treatment that is not on the list.
What's that?
Self-care.
Isn't self-care just an excuse to do whatever you want?
Kind of, but that doesn't mean it doesn't work. Self-care is about taking the time to meet your own needs and to be nice to yourself. And I know just the way to do it. So, how are you feeling?
Self-care is quite a mood booster.
Is that your phone?
Ugh, it's my dad. First boundary I'm setting, no calls during self-care time.
Good for you. Psst. You want some chocolate?
Ooh, is this self-care too?
Obviously, chocolate is a huge mood enhancer.
I like the self-care stuff.
Me too. Thank you for watching. We know that mental health can be a sensitive subject, and we hope this video gives you some tools to help talk about it.
We have some links down in the description if you want to know more about suicide prevention or other mental health topics. With that, we will see you next time.
Make sure to do some self-care.
Absolutely.
Bye.